to Doctor's Care Consultancy and Counseling Services. This is our very maiden launch, and we are so glad to have you, our viewers, our patients, friends and colleagues to join us on board as we have our mental and physical well-being being talked about, being cared about online. Yay! It's a wonderful platform because you don't have to go through the queue of waiting at the hospitals anymore. You can just do a chit chat with your doctor online, and you can just about have almost all the solutions to that concern that's going on with you. Tonight we have a very wonderful topic we are going to be dishing out to you, which we have termed the devil's onion. Wow. Doctor, what do you mean by the devil's onion? The devil's onion is a major cause of trouble happening today, starting from the adults to the young child. It's becoming an impediment in Nigeria, Africa, and the world at large, especially because we have younger children who are now having this trouble. In the layman's language, we will call it depression. But we've tagged it the devil's onion because it is one major act that has got into the health of a lot of people and is causing a lot of challenges. With me tonight, I have Dr. Ekpe, who is going to also be talking to us about what depression is, its causes, and how we can manage it. And of course, I have my senior colleague with me, Dr. Agatha, who is also going to be helping us dissect what depression is, how it can affect you, how it can affect everyone around you, and what we can do to prevent depression. Also, when depression has set in, what is the next step to take so that every one of us can have a better life, live better, and enjoy the very long life that our Creator has made for us. Once again, I say welcome to Doctor's Care Consultancy and Counseling Services. I'm sure it's your first time joining us. Like a lot of friends have been asking us, when are we starting? When are we starting? Hooray! We have started now. So hit the like button, subscribe, share it, and post it on your social media platform. Invite your friends, invite your colleagues, nurses, doctors, and everyone in the health sector, of course, is very welcome. So let's get right into it, the business of today. Dr. Augustine, can you just throw light to us, tell us what depression is all about? People have different notions of depression. People think that it's only when something has happened to you, or when you are in a bad mood, or even when somebody stole your money, you just say, oh, I'm depressed. So can you just give us a light, what depression is about?
Okay, thank you, Dr. Rex. Depression, I would like to say that I used to be among those persons that used to think that depression is limited to a certain type of people.
Okay.
And some people feel depression only happens among those who are poor. But later on, I now discovered that it's not true. Depression, discovered, affects everybody.
Okay.
Whether you are rich, whether you are poor, it just depends on where you are at that particular point in time. It's actually a mental health disorder that comes with low self-esteem. It makes you feel as if you bring your self-esteem very low. You think that you are nothing. Do you understand? You don't, in fact, when you feel that when people are looking at you, they are belittling you. Do you understand? And because of that, you tend to pull away from the society. You don't want to associate it with those around. So I think that's, for me, depression has to do with people having this mental side that they are nothing. And then it now begins to show in how they behave and then associate with people outside.
Wow.
That's what I think.
Okay, so let me ask Dr. Agatha now. So, like Dr. Ili just said, is it just that because people feel that their esteem is low, or is it just, or could it also be that they have a medical challenge that would bring about depression? What are the things that cause depression?
Dr. Erex, before I go into the causes of depression, I would want to throw more light to what depression is all about. Just as like Dr. Ekpe said, depression is a kind of mental health disorder, like you say, or mood disorder, that causes one to lose interest in normal things. that they've been interested in doing before now, okay? It can affect their way of thinking, it can affect even their actions, okay? So it can affect visually everything about their life, okay? That is depression, okay? And there are a lot of causes of depression. For some people, it can be kind of history. Like I said,
something that runs in the
something
family.
that runs in the family, like familiar, okay? It can be familiar. Some people have that history of depression in their family, in that it can just occur. When it occurs, it might be a little thing, as flimsy as probably maybe a little wound on the body can tip that person into depression, okay? Then stress, as we all know. Maybe I will cite an example like the condition in Nigeria now is affecting virtually everybody. And if you don't handle it so well, it can cause depression for someone out there, okay? So stress, in fact, stress to me personally is number one cause of depression if not handled so well, okay? Then sometimes alcohol, smoking, all those things also can cause depression. You know, sometimes, like I said, when you're troubled about one thing or the other, some feel that alcohol is the succor they will get to their problems, okay? By the time they soak themselves into alcohol, from there depression sets in, and if not handled well, it can lead to death, or it can lead to a whole lot of things in their life, okay? So a whole lot of things can cause depression. Probably I may stop here so that my colleagues can throw more light to other causes of depression. Thank you.
Okay, so I think I will just pick up a cue from what you said, the condition of Nigeria, which every one of us is a part of right now, either nationally or internationally. We have realized that a lot of Nigerians, young adults at the moment, traveling outside the country and all. So are we also saying that financial constraint can bring about depression? For example, doctors. A lot of doctors we know now are into the JAPA system. So could someone get depression from not having money to JAPA? Can that bring about depression?
Of course it can.
Okay.
It can. You know, one thing about this depression is the way we view it, the way we see it. Like sometimes even depression can come from just birth. Someone giving birth, it can cause depression.
Oh yeah.
So JAPA alone is not, let's say, the only cause of depression. But yes and yes. If you don't have money to JAPA, I leave the country, because at the moment where you find yourself, you're not comfortable. The life you're living, you're not comfortable. You know, everything is just so difficult around you. So the only option is to look for a solution to that. And most times you're looking for the solution and the solution is not forthcoming. It can tip one into depression. So that is just it. So for that question, yes, JAPA can cause.
That's interesting. Okay, so Dr. Ili, let's look at the youths, you know, the age bracket of 20 to 35, 40, 45. The social media has just gone wild on every facet. You see that children barely 3 years can now handle the gadgets. Now, I realized something, that there are some children who are not able to handle gadgets, possibly because their parents do not have the money, or their parents do not have the finance know-how to, you know, buy them a gadget. So when they see other children who do not have that, these children have a recline. These children coming. So is there a way the social media is adding to the youth having depression?
Yes, I think it does.
Okay.
In fact, let's even go back to when we were younger.
Oh,
you can imagine a mother having 2 kids, let's say twins, and you want to buy a gift for them. If you give this one a toy, you must give the other one a toy.
Most definitely.
Do you understand? So that's you see, we are just talking about a normal family now. You give the child a toy, this one will give, you have to give the other one a toy in order to place the child. Now in this era of social media, that's the same mentality that is being created. Imagine I come to class, all my classmates are having iPhone. And me, I have phone, but the phone I'm having is not as high grade as that. It's not as if I don't have a phone.
That's true.
I have a phone, but when I see my classmate holding iPhone and I'm holding, let's say, Nokia Touch, you can imagine that kind of feeling. In fact, let's even leave that part. Let's go into the social media content. Do you understand? That also causes, you know, you look at what's there. You see people forming. A celebrity will snap a photo and then we unleash the latest style and all these things. You don't know. You don't even know the inner life of that person. You don't even know whether he went to what they went to even borrow a cloth and just snapped it and sent it on social media. And then you begin to imagine, I wish I'm like this person. And then you now begin to crave for those things. You look for any means of trying to make sure that you get that particular thing. And if you don't get it, it starts there. And that's just the beginning. Do you understand? That's just the beginning. And so you see, now it is no longer about depression, now it's now about crime. You see, so you see, from depression it could lead to all other vices.
Very true.
Do you understand? So you see, the main aim was that parents buying phone for their children in order to please their hunger. They draw these children into this kind of situation even without knowing. So I think social media has really done a lot of harm to the society, especially the younger ones.
The younger generation.
Yes.
Okay, let's look at another topic that affects all of us as colleagues, which is the postpartum depression. Postpartum is after delivery. Okay, we realize that a lot of women get depressed after delivery. A lot of women go which even leads to some of them having psychosis, some of them having symptoms of madness, symptoms of irrational behaviors. So what are the things that would have played the role of this woman having postpartum depression? What are the things that can likely cause it? I think I'll take the cue from Dr. Agatha, who is also a mother, not just a doctor. What are the things that can make a woman, to have that depression immediately after delivery?
Okay, let me start by saying, like I said before, we know, and I mentioned before, that there can be family history, genetics, okay? Yes, for some people that already have depression running in their family, just delivery alone can tip one into having puerperal depression, okay? If not handled well, because we are in an African setting, most times outside the country or overboard, there are, before one even conceive, all those things are put into cognizance. They already know, okay, since depression runs in my family, probably pregnancy or delivery could tip me into depression. Okay, before then, they would have taken care of that. But over here, we are in a third world country, we are in a developing country. All we know is that, okay, I'm married, the next thing to do is to get pregnant and give birth, which is normally African setting. That's the way it should be. That's the way we look at it, okay? So by the time the person gets pregnancy, pregnancy comes with a lot of changes in our physiology, in a woman's physiology, okay? So all those changes, when some people see those changes, before you know it, it gets to their mindset, all right? My breast is getting heavier than it should be. My stomach is getting heavier than it should be. Some will look at, okay, I'm putting a lot of weight. Okay, before you know it, their sight, okay, that shape fullness they used to see, they used to have before, is no longer there, and it's turning into something else. And God help you if you don't have a supportive husband, that would want to tell you, you're bloating up, you're looking so shapeless, you're bringing it before you every day, how you look. Before you know it, it can tip the person into depression, okay? So then secondly, most of the time after delivery, the stress that comes with delivery, trying to breastfeed a child, trying to nurture this child, the sleepless nights, keeping up, always keeping awake at night to breastfeed your child. Okay, all these ones could also tip one into depression, okay? And some of the time, if you don't have that support system around, probably your mom or the in-laws around, or even your husband, your spouse, so to speak, if you don't have those supportive systems around you, it could tip one into depression, okay? Those are the likely things that may tip a nursing mother, okay, into that puerperal depression. And if care is not taken, if not handled well, because sometimes the problem there is that most times some don't even see it coming. Okay, some don't recognize it when all those symptoms are there.
Coming.
But if we are very, very careful, if we are observant, you know, people around or even the person, because most times it's very, very difficult for the person undergoing all this to really know, yes, that
this is what is
this
going
is
on with
coming,
him or
yeah,
her.
this is what is coming to me. So, but if the people around are very observant, they will actually know, they will actually see all those symptoms. I don't know, okay, we've not actually talked about
That's
the
actually
symptoms,
where
okay?
I'm about
Yes.
entering now.
So they will all already know that these symptoms are there and they should swing into action, because if not, it may lead to some. In fact, so many people that have landed them in a mental home. Thank you very much.
Oh wow, that's really, really enlightening, you know. And I think it will be healthy for us to talk about the signs and the symptoms that we can see, you know, with people with depression. That's what I mean. Tell us, what are those signs that one can take note of, or one should take note of, or when you see in your friend or your spouse or a family relative, what are those things that can trigger the warning signs to say, oh, I think this person is undergoing depression or is likely having depression?
Okay, thank you for that. I like being practical about my things. Okay, one of those symptoms, I would say, at least one of the key ones I've seen is social withdrawal. Do you understand? Social withdrawal, what I mean by social withdrawal, when you see that someone doesn't like associating with people outside, they pull themselves, they want to be alone, they tend to isolate themselves from even their family members. When you ask them what's the problem, they say, no, nothing, I'm okay. That kind of thing. You should actually go closer to them and then get to know what the problem is, because the moment they start pulling themselves out of those around, then the symptoms of depression will begin to worsen. Wow. You understand? Then another one is maybe this one is, I don't know how you'll be able to get this one. When someone starts having this low self-esteem, do you understand? I see myself as nothing. Do you understand? I don't. You just feel that other people are better than you. Think something you know you can do, you just pull yourself out of it. That kind of thing. That mentality that I'm not like that. Then another one is let's say some end up developing suicidal tendency. Do you understand? It actually starts from when you feel that everybody is against you. People are out to get you. You feel that this person, this smile is smiling, is actually plotting against me. Meanwhile, the person may have been just looked at his phone and saw a joke and is just laughing on his own, and then you feel, oh, this person has something against me. Do you understand? That kind of feeling, people are out to get you. You begin to develop anxiety. That's fear of unknown origin. There's nothing actually stimulating that fear. It's not as if somebody told you, oh, there's a robber coming to your house. No, the fear just comes in. What am I afraid of? I don't know. Do you understand? Fear of unknown origin. You are afraid and you don't know where that fear is coming from. And then you now begin to feel that those around you are actually the cause of that thing. Do you understand? And on the long run, it ends in despair.
Wow.
And despair means that you've given up all hope. You feel that nothing can be done about your situation. In fact, that's even what leads to suicide. So I think those are the key things. I know key things about depression. Thank you.
Okay. So, Dr. Agatha, you've been in clinical practice for over 9 years, over 10 years, if I'm not mistaken now. And you see these patients day to day, they come in, they walk out, you refer them to psychiatric homes, counseling, and all of that. So what are the major complaints they come with that makes you give a diagnosis that this person is likely depressed?
Okay, yeah. You know, most of the time, when they come, they are not the ones telling you I'm depressed.
Oh, yeah.
Because one major thing we tend to find out is that they don't believe they are depressed. They feel that, well, this is the kind of life I want to live, or this is the kind of life I like to live now, okay? So it's actually the relatives that notice that, okay, you know, one have come to my clinic, you know, the mom said, this my daughter is a bubbling kind of child. She's always playful, she's always laughing with people, but all of a sudden she noticed that she started withdrawing to herself. You know, most times the sister will want to play with her, she will just block them off. Please leave me alone. I want to be on my own. I want to be on my own. Okay, this is majorly one of the symptoms you see with them. They are always withdrawn. They want to be on their own. You know, they will lose interest in all those things they like to do. Even sometimes they refuse meals. They don't like eating their meal. Okay, then for some you see them once they sleep excessively. Once she comes back from school, she enters her room, she sleeps for a long time. Then loss of appetite. Sometimes you tell her you want to eat, she'll say yes. By the time they bring the food, she's no longer interested. She'll tell you, Mommy, I've lost my appetite. So those are the things we have to look out for. Okay? Most times they're always sad. Because depression even comes, is this feeling of sadness. They are always sad. You see a happy child, before you know it, that child is always sad. It's always sad. By the time you ask her, sit her down and talk to her, what is making you sad? They will not be able to explain. Then there is this teenager the mom brought to the clinic. You know, when I started talking with her, she said that she had a wound. They were playing and the sister pushed her down. So she fell down and had a mark on the face. Okay, so each time she looks at the mirror and see that mark, she feels so bad. That was the word. That was, she said, Doctor, I feel so bad. I feel so bad. You know, my face is no longer beautiful the way it used to be. So you will see that is only a little thing, like a little thing can tip that person, that causes, and before you know it, like Dr. Ekpe said, they will start having that suicidal mission. Now my face is no longer beautiful. You know, she'll go to the class, she'll look at the faces of other classmates, and she see that no, they don't have mark. Why should it be only me that will have that mark on my face? That is just that trigger. Just that mark on the face that was just the trigger that tip down into depression. So you have to refer the mom to a mental home, to see a psychologist. You know, this we keep talking to her, make her understand that you're unique in your own way with that mark on your face. Okay, I have to show her the mark on my lip. I say, people tell me you're beautiful. Oh, with this mark, it makes you unique. Say, wow, doctor, really? Okay, you could see her. You know, because of that, the mom would like bringing her to my clinic. You tell me, doctor, please, whenever you're less busy, maybe during some few hours to your closing time, you know, patients are not coming in there, I could bring her so that we talk. And she comes and we talk. You see her, you know, most times what they need is that encouragement. To tell them that that's in there, yes. You look for the words to give to them, to tell them that that thing there is not an impediment, rather it will add to your beauty. Before you know it, they are out of that depression. So all those things
at the time. This is really enlightening, and in fact it takes us far abroad to everybody, from child to teenage to parents to spouse to husband, even to parents. Sometimes our parents are depressed. I remember then, you know, last year when my mom came to see me, and you know, she was just upset about a whole lot of things, and I just said, okay, you really had all this in your mind. And you know, but we had time to talk, and I realized that as a result of some things she has kept in her mind for a very long time, some things we've not had the mother-child discussion about, you know, it led her to this level of depression that, look, I didn't just get it, and I felt, oh, I didn't even see it in that light. But because, you know, the distance of, you know, the relationship, I'm now married, I'm no longer her, you know, her best buddy, like, you know, we used to be before. You know, those are the things, you know. And I think it cuts across with you know, newlyweds too. You know, that bond of, oh, my family, my siblings. But now you're living with a new woman, somebody you've not known for a long time. Maybe you courted for 6 months, 1 year. No matter how long you even courted, you can't even have bonded as much as, you know, siblings would have bonded. But you have to learn and unlearn a whole lot of things. So in the first 1, 2, 3, 4 years, a lot of young couples get into depression because they don't have that support system like they used to have before. So I think it will be very wise for us to start counseling people, encouraging people to have good support system, friendships, relationships that you can talk about,
Healthy
something
ones.
healthy ones,
Healthy
yes.
relationships,
Something is
yes.
bothering you, you can air your minds with them. They can have talk about it, gist about it, make fun about it. Not every fun and jest is taken, softly. Some people take fun to the extreme. Why some people take it that oh it's just fun, she was just catching a jest with you. While some other people will start not sleeping. That's one of the signs of depression. They start thinking, start worrying, insomnia comes in, no sleep, and find it difficult to sleep because they are thinking and worrying about things that ordinarily would have just meant nothing. So I really hope that this has been a bit enlightening for every one of us. I would just like us to wrap up with a few things before we come back again with this counseling on depression. What can we do when we notice these signs in our friends and family members? How do we tell them? How do we tell the person? It's enough to know that somebody has the signs. It's also much more troubling when you have to tell the person, oh, I think I need us to see the doctor. What do I tell the person that I'm taking him to the doctor for? The person may not even feel that he or she needs to see a doctor. So whom do I use to tell this person that you need a doctor, I would like us to see a doctor? Can you trust more light? What do we do when we see these signs on these persons? What do we do? How do we get help for them?
Okay. Sorry, before I dive into that, I just want to say a little thing about those particular group that are affected.
Okay.
You understand? Remember I said before, I used to feel the poor people are more of the victim. However, some other people feel the female gender are more affected. Do you understand?
Yeah.
But study has shown that males are more affected.
Wow.
And they commit even more suicide. Actually want to point this because I'm a male. We have this pride. When a man is depressed, he feels I should be a man. Society feels you should be a man. Your family feel you should be a man. And so a man should not
feel pain.
Should not feel pain. In fact, he doesn't have the right to complain. And that's where the problem starts from. Why am I saying this? Because I know most men are having this depression and they don't know what to do. Do you understand? And they lock it up. They feel that since I'm a man, I must be a man. And at the ending, most of them fall into suicide. So why I'm going into that is so that men will know that, people will know that not only females are affected, in fact, males are affected more. And if you are a male, do not be ashamed to seek help. I've met, in fact, there was a man I met, when I discussed with him, I discovered that he was actually slipping into depression. After counseling him, he was happy. Do you understand? So even as women seek help for this kind of thing, men should not be afraid to seek help. Do you understand? And I know it's very hard to actually convince somebody that does not feel that he's depressed to go and see the doctor.
Very true.
For me, what I feel is you can coin it and say, well, come, let's go for medical checkup. Do you understand? You can say, okay, let's go for a medical checkup, and then you go for the medical checkup, and then you see the doctor privately, and then tell the doctor, you see this my child, this is the main thing. I just brought him, he doesn't know. The doctor knows what to do.
Yeah.
But you must take your child to the hospital. Keeping your child at home will not solve any problem. That's what I feel. I don't know, my colleagues may have better options.
Okay. Yeah, let me throw more light on that. Honestly, Dr. Eke, I really love this angle you came from. Okay, men, yes, men have this pride, and like the society have made it, in fact, African setting, men are in the forefront. Even when the bullet is hitting them, they should be a man. Yeah. Okay, so now I want to talk to our female folks, the wives. Sometimes you're the one closer to your husband.
Sure.
So most times when they are going into this depression, you're the first person to know, okay? Except if you're not very observant. If you're very observant, you're the first person to know that my hobby is not the person he used to be. And all these little signs, you should be able to know that my husband is going into depression and you should step in, you should help. Talk about it.
Yeah.
Talk about it with him. Sometimes some do understand, some will understand, and at a point they may open up to you, and you'll be able to find out what is really the cause of the depression. Because most times it's just a thing. It's
Sometimes
just
money.
Yes,
Sometimes
it's just a
sex.
thing. It's just one little thing that can just give it a tap like that, and before you know it, it goes off.
Very
okay.
true.
So if you're very, very observant, you actually know that something is wrong somewhere. Look at the signs, look at the symptoms and see it. And yes, those symptoms, when you see them, first of all, talk about it. By the time you talk about it, some definitely open up. For some that don't open up, then you may seek for help for the person. Sometimes they may not agree to go with you to the hospital, but then look for the person that they listen to. I believe in this life, everybody has somebody they respect and somebody they listen to. So if you're able to reach out to that person, I think that person will be able to convince him to see a doctor. Okay, I think in this way it can also help to also help us to seek help for our loved ones that likely have depression.
Wow, what a wonderful evening, what a wonderful time tonight. It's been very expository, it's been very enlightening, it's been really teachable tonight. Thank you so much, Dr. Ekwe, and thank you so much, Dr. Agatha, for throwing us this light tonight into what depression is, what are the signs and the symptoms we can see, and how that we need to seek help on time. We need to seek help. So if you have any friend, any relative, or even yourself, you are noticing some changes and signs happening around you or within yourself, or a friend around, or a colleague, please don't fail to seek help. And of course, that's why we are here at the Doctor Care Counseling Services. The reason why we are opening up this platform for every one of us is so that we can be able to have the extra time to say those things we don't get the time to say during the regular consultations at the hospitals. You know, when you go to see the doctor at the hospital, you're checking your time, you have to get to the office, there's a waiting time, there's another patient waiting to be attended to. Oh, and then or sometimes the doctor may even have an emergency, may not have all of that time to sit down and have this talk with you. So with us at Doctor Care Consultant and Counseling Services, our aim is to have this time for you. Let's get this talk. Call us, put a call through, book an appointment, book a day. We'll give you a time frame where we can have this talk, where we can sit down, where we can have this conversation, not just about your health, but the mental well-being, which is our focus, because our primary aim is to help you get better, not just take medications, because everything doesn't lie with medications only. It also lines with the mental health. So please ensure that after this video you like our button, make a subscription, subscribe to this channel, tell your friend about it, follow us on Twitter, follow us on Instagram on our handle that you can see right at the bottom of this video. Follow us also on our TikTok platforms, where we're going to be sending you health updates, daily information about your health, things you need to do to have a wonderful mental health. And we, of course, are going to be seeing you very soon. So from every one of us here, we say thank you. Dr. Ini, just give us a wrap up word. Thank you, Dr. Agatha. And we'll be calling it a very good night from here.
Thank you so much. And I want to tell you, you can do all that from the comfort of your home.
Yeah.
Yes, you can do all that from the comfort of your home. So please, have a chat with us and you will never regret it. Thank you very much.
Thank you, Dr. Agatha.
Thank you for joining us. We'll be seeing more of these videos from time to time, and make sure you reach out to us. Thank you.
Thank you. So our email addresses are right at the bottom of this video. Our Instagram, Facebook, Twitter, all our social media handles are going to be coming up right just after the bottom of this video. You can reach out to us. Of course, you can put a call through. Of course, make a booking, and all of our doctors, seasoned doctors, will be very available to talk to you whenever you need. My name is Dr. Rex. Welcome once again to Doctor Care Counseling and Consultancy Services. Have a wonderful night rest. God bless you.